burned on both front and back. That's how much?
36.
Wait, what? Oh,
Both
9
legs.
times 4. The whole trunk and chest and everything is 18 on the front and 18 on the back. Your arms, if it's the front side or the one side is burned, it's 4.5. So your whole arm is 9. But if it's front or back, then it's 4.5. And then your head gets 4.5 as well, front and back. So 9 total for the whole head. But they take head burns and face burns very seriously because those are closer to the airway. So if I give you a question that says, okay, this patient was burned on the front part of the right arm, was burned all across the chest, and was burned on the front part of the right leg, how much of a percentage of burns? 31. 31. Oh, okay. Is it 31 and yeah. So that's why it's just doing math for and this is probably why she didn't go over rules of 9. Kids are a little bit different. Okay, if you notice, don't look. But this is total. Okay, so these are total. So total leg, total leg, total leg. So kids are a little bit different.
You got the head as 10 instead of 9.
I don't know. Just it's 9. Okay. But the head, like I said, the head is a little bit different. But I don't have anything. I do, but not according to the rules of 9. They also have the Palmer method, where you can use the palm kind of, and it's 1% every time you move your hand across the burn area. So say you have a small area that's burned on the chest and the whole rest of the body is fine, or on the arm, you can take your palm and just say, is it 1%, 2%?
Is it their palm or your palm? It would
Their
be
palm.
Their palm. Okay. It's not sick as a kid, I didn't.
No, it's their palm, because it's their body surface area. So, they use that if it's like a scattered kind of thing. It's not like the whole arm, the whole leg. Alright, so kind of going back to A&P, the depth of the burn determines on what layer it's affecting. So normally first degree burns doesn't really get down to anything, it's just on that surface area, in your epidermis kind of thing. And then they have superficial second degree, which kind of goes down into the dermis a little bit, but not all the way. Your deep second degree burns are going to go down a little bit further, but they're not getting into your vessels, your subcutaneous glands and all that. Well, not glands, fat, I guess. But full thickness is going to be all the way down, and you can see subcutaneous fat, you can see muscle maybe, you could also see some veins and arteries and nerve endings and all that stuff. Bone, muscle. That's your different degrees. I'm not going to go into the functions and all the tissues and stuff. The way to determine the degree of the burn, the easiest way is partial thickness burns appear to be wet to touch. Okay. Full thickness, it looks a little bit more drier because it's gone down and it's not all those vessels and stuff are already exposed. So that's the best way to determine when you're looking at a burn. Of course, we look at the color. Okay, so first degree burn. So what would be considered a first degree burn?
Like a sunburn.
A sunburn, okay. Most of the time it's sunburn. Maybe they got scalded by some hot water a little bit. It's painful, hypersensitive, but, you know, should heal within at least a week or so, depending on how bad the burn. Okay. What do we do with, what would we suggest?
Aloe vera.
Aloe vera, okay. And they need to get like true aloe vera, like not like the lotion, okay, that have aloe vera in it. Because those have scents and all sorts of things added. You need to actually get the aloe vera, like either the gel. We have a plant that helps aloe vera. I actually drink a little bit of aloe vera in my coffee every morning. It's good for you.
Do you squeeze it from the actual?
No, I have the lid. But yeah, I squeeze it from the plant when I have a sunburn though. Works really good. Do not use food products. So what is a
Butter.
Butter. Vinegar is okay. Okay. Butter, people,
Yeah.
the fats and stuff and the butter and the oils and the, well, not oils, butter and mayonnaise. Some people do mayonnaise.
Like some
Okay.
cannibalism stuff.
All it
going on
does
there.
is it kind of cools off the skin, really. It doesn't, and it helps a little with healing afterwards. And apparently, people say it works for burns, but you really shouldn't be using food products on your skin.
What about milk?
No.
No food products.
No
And
food
this
products.
Mac, my mom had, like, she was cooking chicken and the grease started popping like a fire. And somehow the thing, the skillet fell over and it fell on her arm. So I went to go get butter and I started putting her, she was like, it's burning. And so when we went with someone to the emergency room, they was like, well, why are you in so much pain? They was like, she put butter on me. That's how I was like, oh, so you're not supposed to put butter? They was like, no, where did you get that from? I was like, you know, my great-great-great-great-grandma and them, they put butter, like, you know, butter. But that's when I learned, like,
So
you do not
back
put
then,
butter.
butter was butter, and now there's a lot of additives and think about it, butter has oil and fats and stuff in it, so it's just not good for you.
I'll say, I know one of my first jobs, I worked at McDonald's, and they'd always say when you get burnt, put your fingers in the pickle juice. But I think it was just because it was cold to like cool it
It's
off.
a vinegar.
Is that what it is? Okay.
And they told me
Now I
to put
will
salt.
eat pickles from McDonald's.
Salt.
Yeah.
So what put salt. My grandma.
Yeah, I know.
That will put out the fire.
That'll put out the fire.
She said that way you don't get the little bump. The blister.
But so that's your skin healing. So I would you know a lot of times you're not supposed to pop blisters. If you don't know that. I mean sometimes they have to, depending, but a lot of times they won't pop them. They're supposed to naturally kind of go on their own.
You say what the vinegar does?
I think it's for pain.
It's mostly for pain, and I think it helps with the healing process too. It does have sodium, a little bit of sodium in the vinegar, so I don't know if that helps. Because you know, when you burn, your skin burns, you have a lot of electrolytes, like in your skin and stuff. So you have a lot of things that help healing and all that stuff. So that's why they lose their electrolytes get depleted very easily. But I use vinegar doesn't. I clean with vinegar. I use it for everything. But yeah, no food products. Okay. Partial thickness. So those are blisters, big blisters on the skin. Okay. But yeah, so higher temperatures, prolonged contact with hot liquid, super hot liquid. Sometimes it's chemicals that can cause this. But they're normally moist blisters. They might be weeping. They're blanching. A lot of times you get swelling and stuff or edema in that area. Very, very, very painful. Okay. Has anybody ever had? I have.
Yeah.
See, that's how can we prevent sunburn? Sunblock, okay, at least the higher SPFs, okay? I don't really know about those 100. I don't believe anything over 50. I'm kind of like, it really works. and make sure, so they have all these new, like, preventative lotions and stuff that have all these like, oh, they smell like this. No, you don't want those, okay? There's some that like are made with coconut, like, oil, like, and I'm like, nothing oil should be in something to prevent you from getting a sunburn because of the fact that oil is going to attract the sun. So, that's why I don't like the sprays, okay? The actual lotion is better. And you know you're not supposed to like, rub it in, right? It's supposed to sit on top of the skin. So you might look a little white, on there, but, you're not supposed to rub it in all the way.
Is this what basic or which
This is, yeah, this would be secondary. Yeah, partial thickness secondary. I don't have a picture for full thickness, but obviously full thickness is gonna be destructive to all layers of the skin. Fires, you know, chemical, electrical currents, so if they get hit by lightning or they are working on power lines and stuff like that, that's another, a lot of times. They're the hardest ones to treat, apparently, is the electrical ones. But it looks real dry, leathery, it can even look super necrotic.
I know this is off topic, but I just remember from physics, it was, you could withstand like 1 million volts.
Keep
It's like
going me
0.1
off.
amps of code. It's like amps is what kills you, in other words, so it's just interesting, you know, because you can get struck by lightning with 2-3 million volts and survive, but, you know, a vacuum cleaner will kill you.
Because it's got more.
Well, you sound like a country singer.
Sorry. I turned into Randy Travis all of a sudden.
You need to keep that voice. You tickling my ears.
So a lot of times they actually don't have a lot of, the pain is coming from more of if they have any, second or if they have any partial thickness or, degree burns, that's where the pain's coming from. Full thickness, their nerve endings have been burned through, so they don't really feel it.
Oh,
So there's a third degree. As you can see, the skin is basically, the top layer of that skin has come off. This is skin right here, it's coming off.
In third degree, you get nerve damage, right?
Yeah.
But second, you don't.
Well, it depends on, so it's the partial and the full is
Okay.
where is the depth,
Okay.
okay? Third degree is more of,
I was told the third degree they don't hurt because of the nerve is damaged. The second degrees hurts the worst.
Partial and full, so when it's full thickness, the nerves are damaged.
When it's full thickness, nerves are damaged.
So normally third and fourth, it's gone down to full thickness. It's only second degree that you can have either or, like partial and full.
Okay, so you can be second degree and full.
So
Okay.
see how you can see their, you know, veins and their arteries and the little capillaries. That's scar tissue. So this is all dead tissue, right? That's died already. And kind of gone. It's covering the wound. I'm sure y'all have seen those on like pressure ulcers and stuff. Pseudo eschar, so it's still eschar, it's still dead skin, but it's like just kind of superficial on top. It's more yellow than it is black.
Yeah, and that's
And
sticky.
what hurts the most when they go in deep.
hmm
So has anybody ever been into a burn unit?
Unfortunately, I have. It wasn't a great experience, but yes.
So did you go in the tub room? It's really hard to see, cause the tub room is, they basically
Oh, she's talking
like
about as a student.
spray off into the definitely.
Don't they scrub it or something?
Does any medication prepare the patient for that?
Yeah, they have to pre-medicate them.
I was gonna say they knock them out or anything, or? Oh, God.
And it's the medicine still hurt.
Sometimes they will, intubate them and all the way.
Oh, Jesus.
How often do they have to do that, like scrubbing down?
It depends on the doctor and the type of the bone, or the type of the burn. So, sometimes they go once a day, sometimes they go 3 times a week, so it just depends on it.
Do they do it before it's after or something, or how does that?
Sometimes,
Okay.
cause they have to debride that before they can have a fresh skin. I did Shriners as a PD rotation, and I got to be in the OR, and I got to see the skin here. That was cool. Shriners hires VMs, they're, not hiring at the moment, cause I checked with, Dylan, she's a previous VN student from here, she works there. But she said that, you know, if she sees anything come up, she would let me know.
My niece was there. Melissa, she had 99% degree.
What happened?
She got it. The laundry room, I think they don't know if it was a dryer or a washer that exploded, and her room was right next to it, and it was during night. So.
She's okay now, though?
Yeah, she's okay, but they keep doing skiing.
Oh, she's still,
Yeah, she still does that.
Mhm.
And she was only 11 years old.
Kids are resilient. Fourth degree, you obviously can see bones, tendons, organs, muscles. So a lot of times this is an electrical burn that causes it. You'll see very charred skin, and you'll see skeletonitis. A lot of times they need either fasciotomy or amputation. And apparently, sorry. Should have pre-warned y'all on these pictures are pretty gruesome.
Oh, that's a baby? No, that's a lady.
That's a grown woman.
That's a grown woman. You can
I
see
seen
the
the fingernails, yeah.
right here.
But the legs look little at first.
Yeah, they're swollen. You can tell there's like all that edema up there.
They'd have to amputate, right?
Yeah, they did a fasciotomy, but they might have to, they might
Like
have
at
to.
least one.
Yeah. But they might have saved it if they did a fasciotomy, but the other leg looks pretty gone.
The foot looks like it's gone.
Yeah. Maybe the foot. So, a lot of times these are the complications that happens with burns. So, what could be a complication from a restrictive dressing?
Circulation.
Compartment
syndrome.
because the swelling underneath creates that pressure. We definitely don't want them to be in any kind of cold temperatures. So if you notice, if you've ever been on, it's hot. They keep it super hot on that unit in the rooms. The OR is extremely warm. They even told us, like, if you feel faint or anything, like you need to eat, you need to hydrate and everything before you go in there, because you can, a lot of people pass out because it's so hot. So they are at high risk for metabolic acidosis, and very, very high risk for infection. And that comes later. That comes after they've kind of degraded the wall. Main goal is to promote perfusion. So we're going to do a lot of assessments on their perfusion. Just showing us very we're not going to talk about the kind of specific to these are all the different types of burns that you can see. So flame, obviously from fire, scalding, so the hot water, electrical, chemical. main thing on this is that, they have to have EKG monitoring for 24 hours. Because they can have like, if they're, you think about it, your heart has a conduction system, has an electrical current going through your heart. So if they get shocked by anything or they have any kind of added electricity, think about what we do when we are shocking somebody to bring them back to life. That's an electrical current going through their body. So people have gotten little burn marks from the old school, paddles. Okay, that's why I don't use them anymore. Because they didn't put the gel on them and then they shocked them and they got like a little surface burn. So that's why they use the pads now that have the gel on them already and all that stuff. So we have to have EKG monitoring. We don't want them to go into any kind of arrhythmia. That's the main thing with electrical burns. And that's 4th degree. So, got some fingers missing. And this is, obviously they were holding on to something, that electrical current, and
Have you ever heard that before? Like, I don't know, they taught us this, like, if you ever have to check if a current, like if a fence is electrical, if it's active, like in an emergency situation, you always touch it with the back of your right hand. And the reason why is because whenever, if it is positive, you're gonna grab. And so what ends up happening
yeah,
is
your hands automatically jerk.
will jerk, so when you touch it the back, you'll pull away. But if you touch it with the front, you'll grab on. And you always do the right hand because the heart's on the left
Well,
side.
I'm just gonna go
The stick won't show if it's conductive. Yeah.
Okay, well, I'm gonna be like, hey Travis, this is like,
Yeah.
can you come check your hand? Cause I ain't doing that. Alright,
You can pee on it and it'll shock you. That's another way to do it, so.
Yeah, could you just like squirt some water? Yeah.
No, you have to, because you won't know if it's active or not.
Well,
What
what
do
does peeing on it do?
it'll come up
It's
the
gonna
line.
shock the
It'll
whole
shock
body.
you. It'll shock you, but it won't kill you.
Normally those electrical fences don't have enough like amps and voltage
Right,
to
yeah.
you really harm you. It's just kind of like make sure you don't climb it. This is a deep tissue injury from an electrical conduction, so you can see all the everything. Looks like they've gotten some skin grafts. You can see the grafting here and then up there. They use all sorts of stuff now. Fish scale, fish skin. They can use it from cadavers. They can use your own skin. They can get it from somewhere else on your body. Chemical burns. So these are all. This is why we have what is it called?
MSDS.
MSDSs. Okay, that's why we have those. You can read over it. If it's a chemical you're using, especially to clean up something. So when we have like chemo spills and stuff like that, they have specific chemicals to clean that up with. It's very important to know what you're cleaning with and what needs proper PPE and all that stuff you need to put on, because chemicals can burn you. Oh my gosh. So speaking of, I didn't get burned, but I was cleaning, okay, I was cleaning the house and I was cleaning all the bathrooms, and I realized I had to clean my tub, or our tub in the main bathroom, and I wanted to take a bath that night, and so I was like, oh, let me clean it real quick, and I normally use vinegar, but we were out, so I was like, okay, well, I'll just clean it normally and let it sit, okay, and I got distracted, and I washed it out, and I cleaned it out, but then I got out of the bathtub later, and I was like, I smell like bleach, so like I probably didn't clean it enough. Bleach is too, it's good, but it's a little harsh. I think my son had that other thing there. Use vinegar. vinegar. I use vinegar to clean everything
I
out.
usually use Hardy Woods.
Mine just for smelling good.
No, they have an antibacterial. It does have antibacterial. But when you add scents to
Have you ever heard of, this happens, like a couple hundred people die a year from chlorine gas? Because they mix bleach, they're cleaning the toilet and they mix bleach and other products. The chlorine gas kills them, but you can't smell it.
Same with,
What about laundry? You can put bleach in your laundry, right? In your
Yeah.
dress.
It's just, it's
I don't do that anymore with my house. Yeah, I do.
Vinegar, I don't like it. You can put vinegar with baking soda and it makes your like.
Yeah.
I can't handle this.
It won't smell like, well, my clothes don't really smell like it. I do my fruits and vegetables the same way. I do, I give like plain water, just a little bit of water, some vinegar, a cup of vinegar in there, put baking soda, mix it, and then put my fruit and vegetables in there. It'll bubble on your fruit and vegetables. That means your fruit and vegetables are.
Miss Matt, they was asking earlier, how does it work? I looked it up and it said that the vinegar has an antimicrobial action, and then it also prevents biofilm formation. It has a soothing effect for minor burns, and then it neutralizes the alkaline.
I was gonna say it probably neutralizes it.
Yeah.
You can use it for cleaning too. You just have a little bit of any scent that you like the little oil that they have. I usually do rosemary for lavender.
I feel like we've gotten, we're too, our chemicals that we're putting have gotten a little too not. And vinegar's cheap too.
But it say don't use it for open, if it's open, or if it's deep, don't use a vinegar. You delay your
that's
healing.
more for surface burns. Like
Right. Sunburns.
What kind of vinegar do you use? The white one or the apple cider?
We always get both because the apple cider we like to put in our, we make our own juice. So like you can it helps, it's just for your GI tract. Okay, this is just, we're not just, this is just acid, that's what, happens.
Did he take off a finger? Is it
I
miss?
think it's just hiding. I think it's just hiding. Okay, maybe not. Maybe it's missing the thumb.
Yeah, something's wrong.
These are two different.
Like it's bent, like this. Ooh.
So, is he gonna be okay?
No.
I'm sure.
That's tar, so he's
Really-
stuck.
This is a really old picture, you know how I can tell?
Because it's not
The hair split, see? It's cool immediately, can remove through using fatty oil. That's the only time the Walker Burn nurse was like, that's the only time we ever use, she was like, we try not to use mayonnaise. They use Vaseline for the most.
At what percentage of a body being burned are you worrying about death as a possibility? Is it like 50% or 60 or at what percent? Because isn't there like a point of like no return that the body can't heal itself? I forget what the percentage.
I mean, but obviously 99% she's still alive.
Oh, wow.
I guess it just depends on, and it depends on the health before you got burned. If they have other conditions, heart conditions, diabetes, stuff like that, they're not gonna heal very well, and they might have struggled.
So this man is tar. He's just like tar that they use for the concrete, for the roads and the top of your roof.
Dip them in cold water
Oh.
to dry it.
Yeah, so they have to cool it immediately, and then, they have to put a whole bunch of stuff on it.
Yeah, no, just let me go to the heavens. What the what? That's stuck to that
I would have
man.
to ask her, this isn't very, she was like, we don't see these very often.
That's crazy.
So, I mean, that must have splattered on him somehow. Maybe
Somebody was mad at him.
Or, one of these workers that work on the road, like,
How many slides on here? Like 8, 10?
That like leak through his shirt when he was out there.
On his fire?
That's what I'm like.
Mm-hmm.
Maybe it was there, he looks kinda young. Kinda like Grey's Anatomy, have y'all seen? Simmons? Stuck in the, cause he got in there from a dare.
No.
But that was burning him from the, cause it's still a chemical. Yeah, this is just kinda going on. For just a burn.
No way.
So these are all the things that you might have to do as a nurse. We might have to put an NG tube in. If it's affecting their airway, even if they don't have a burn on their face, if they were in any kind of fire, we need to check their throat, the back of their throat for soot. A lot of times they inhale the soot and it'll burn that respiratory system, and then they'll get inflamed in there, and then they won't be able to breathe. So a lot of times we have to establish some kind of airway. We'll of course assess the percentage of the burns, because we have to know the percentage of the burns in order to treat. Because there's going to be a fluid resuscitation that we have to do with these patients. A lot of times the skin, when it's exposed like that, your body's going to go into dehydration mode. So we need to establish IV. They might need a Foley. We're always going to be assessing their pulses, especially distal to the injury. Burns is pretty a focused assessment, but we still worry about LOC. We still worry about, airway and their heart and everything. That just kind of shows you the burns can affect every single system. How can a burn affect the GI system?
Your body is shocking, your motility can slow down over time.
Yep, and what else are they getting constantly?
And, pain meds. Yeah.
Pain medications, so they can be constantly. And when your body's dehydrated, you're not getting enough fluid for your GI system to be able to, have those problems. Y'all don't look too into this, I'm not going, that's too far level for you. Okay? It's just kind of breaking it down on what can happen, tachycardia, stroke. This breaks it down on each system on what is happening in the body. So CV is cardiovascular. So a lot of times we start to constrict when we have a burn. So first when we constrict, then everything your blood pressure can go, can fluctuate. We can have an MI. There's organs aren't getting perfused properly. Respiratory, they can go into constriction as well, so that means they're going to have respiratory distress. Metabolic wise, they'll go into metabolic acidosis, so that's something that, we got to watch their electrolytes and their bicarb and all that. Maintain gut integrity, because a lot of times they've lost muscle mass over time, especially depending on how severe the burn is. Basically telling you how our systemic effect is going. We're not going to go too in depth. These are the different stages of burn. So you have your emergency, they go in. The first 24 hours are crucial. Okay, we got to figure out what kind of burn it is and how to treat it. And we need to get them, a lot of times they're hypovolemic, so we need to get them some fluid. Then they're in their acute phase, so that's after the 24 hours. And this is like when they're going to start debriding and closing the wound. And then they also will need some kind of rehab afterwards, especially if it's anywhere affecting a joint area. They're going to have to do some kind of physical. And they're surveys whenever I get to emergency medicine tomorrow. So these are the main things that we're looking at. Airway, breathing, circulation, ABCs, we always look at those first, right? Then disability, do they have anything that could hinder them later on? Do they already have some kind of history? You know, do they have a disability? Do they have disability? Doesn't just mean physical, okay? Do they have a mental disability? Even health history, okay? If they have any kind of history of cardiac disease or diabetes, that can fall in that line too. And then environment, what kind of environment were they in? We're going to talk about, so airway injuries, obviously, anything affecting the chest and the head are automatically, they're going to be concerned about airway. That's basically the main thing. And we're going to give them 100% O2, especially if they inhaled any kind of smoke. So sometimes they have to establish the airway. That one, obviously, they have one through the mouth. That's an NG tube. I'm not really sure that. But they're all swollen and stuff. You see their lips are kind of have edema, their tongue is swollen. I'm surprised they even got a tube in there. So sometimes if they can't get a tube down their throat, then they're going to have to pipe them and give them a trach temporarily. Like I said, I'm not going to go, it's kind of higher level for all of these. See the facial edema, super swollen. Obviously, we look at their rate, their depth, and their chest expansion. Are they expanding their lungs? Do they have a pneumothorax? Did something happen and one of their lungs is collapsed? That's what we're kind of looking at when we're talking about breathing. Obviously, this patient had such severe burns where they had to go ahead and they cut that. So this isn't the burn, they had to do basically a fasciotomy on their chest. Because the swelling probably got so bad, it was crushing their lungs, and they had to, it's called an espirotomy. It's a little bit different than fasciotomy, but not as deep. Not as deep, yeah. But think about when you get a sunburn, how tight your skin feels. They have swelling and burn on top of that, so it's real tight on pressure. Okay, circulation. So these are checking all the pulses. Obviously the skin's going to be burned, so it's going to be hard to check their skin color and stuff like that. Even their capillary refill, depending on where the burn is, we may not be able to assess that. So we rely a lot of times on pulses to kind of tell us. You might have to get a Doppler to get their pulses and stuff. But establishing IV access is going to be the main thing, and then watching out for compartment syndrome. Elevation of involved extremities is required because we want more blood flow going to that area. So this is the espirotomy showing. And we all kind of know about compartment syndrome. I'm not going to go over that. It's a fasciotomy, so that's a little bit deeper. So there is abdominal compartment syndrome.
Okay, is that someone's hanging out with their body?
Yeah, that's it.
Are they alive?
So they pulled, it looks like they went ahead and pulled those out. That looks like maybe they're in surgery. Because they have I'm guessing, I can't really tell.
They take it out and put it back in them? How do they put it back in to where it goes to where it needs to go?
I don't know,
Good girl.
But they can take out the bowels and they do GI surgeries. They take out the bowel, they run the bowel, they see the dead part, they cut it out, and then they put it in.
Oh, no.
With C-section.
They're gonna mix me like.
Yeah, with C-sections, they move everything and they take stuff out. And then they
What
take
about
it
food
out.
packs? Don't do that.
I don't know about that.
That's just all
Muscle.
tissue.
Muscle and, not muscle, yeah.
Well, if they go down to the muscle and they tie them, because like me, I would have to get, because I had a baby. A lot of women, our muscles are separated,
Mhm.
and to have that like 6-pack look, you have to get them tied back together. So
Okay.
like, if I had the tummy tuck, I would have them tied back together because they're
Up
separate.
here and down there.
Well, I'm not supposed to be-
Yeah.
That means subcutaneous.
Yes.
I only have 15% or 16% visceral fat. So like it's all subcutaneous. Like the hardest thing to lose.
Yeah, it is.
So I will have a tummy tuck. So if y'all come back in transition and I look a little different.
Coming up in here snatched.
What her baha yeah.
It'll probably be done during the break.
We know what you're trying to do. Get ready for that wedding gown.
Oh no, I'm not doing it before the wedding. There's
No?
I might do it after, right after though.
Yeah.
Do you still? I wish I could, but I don't have time. You have to have at least 6 weeks off.
Oh, yeah.
I could probably come back to work early. Anyway, okay, so we will be drawing like ABGs and stuff to check their pH levels because normally, like I said, they're in acidosis a lot of times. These are the 3 different fluids that they tend to use. So anything, they don't use D5W a lot, but a lot of times if they're lacking some electrolyte, they might throw that in there. Of course, they'll check their glucose because a lot of times that can actually be affected. The main thing with burns in circulation is hypovolemia. So we want to prevent it from happening. They're probably already going into dehydration mode, so fluid resuscitation is going to be their first priority. And a lot of times it's in the first 24 hours is the most fluid loss that they have. So,
Is the fluid being pumped back into them, without them?
Yeah, it can, but also the edema is already in the skin. You know, anytime you get cut, or not cut, anytime you have any kind of injury to your skin, it tends to kind of swell a little. So, burns especially because it's going down second and, not first degree, but second and higher goes down into that dermis. So. All right, so I'm not really sure in your book. I know in the RN book it says 2 to 4. There should be mLs, not cc's. That's kind of an old school thing. But we're going to go off of 2, okay? So whenever I give you, I'm going to give you a question where you have to calculate how much fluid you will be giving that patient. So you do it, it's 2 mLs, and it's divided by their percentage. So I will go ahead and give you the total body surface area percentage in the question, so you don't have to like calculate that. And then you need the patient's weight in kilograms, and then they divide it by 16.
Can we do this practice?
Yes. Yes. So that we can, I will do it for the review. Perfect. Because I haven't quite created that question. And normally what we, and that,
Like, how would we do that? You're available in your half, like, our half of our percentage body weight?
wait, what?
More than 2? I mean,
So remember I told you that the rules of 9, that's your, you know, it only goes off of your percentage, right? So say they have the 18 and the 9 or the 31 and a half, like that's your percentage. Okay. I'm trying to think.
are we gonna go by that?
we'll go off of the book, she says it's 4, right? Wanna say it again, 4. This was the 4 mils times
Percent of burn, weight in kilograms.
Times weight.
In kilograms.
and there's no divided or anything? Okay. Well, no, don't worry about this one then. That's what I'm saying, like, if they divide it by. So it might, like you said, it might not look. They just, I know, so she was telling me that the American Burns Association, which is what normally our data comes from, for that kind of stuff, is they've gone away from partner than this formula. And that looks like it's following like the so that one makes sense. Just follow your boat down up there, make sure, anybody's not here. Oh, here's Parkland, so she kept it on here, but, so there it is. I don't think it's I don't think she meant to, I don't think, that's why I was like, divide, that's why that's kind of weird to me, she probably shouldn't put it. I think it's so it should be times by the weight, because we wanna go up, right? We don't wanna give them less than 4 mils. So that's right. Just go off of what is on the board. Oh, that's why she put the 16. So half of that, whatever total you come up with, half of that is given in the first 8 hours. Okay, and then of course, the rest of it is divided by the 16. That's the part. I guess now they don't do that 8 hours, it's just 16. And then divide it by. They want to give more of it within the first 8 hours because it's crucial. So I will have, and like I said, we'll do a question together on next Tuesday or whatever. It'll be a review for the exam and for,
We almost out of here.
and it's the med section. You don't do a review for that. Cause the exit, y'all been doing the modules and stuff like that, right, or whatever, y'all have.
Question, man, when I signed up for the exit, it said 7:30 a.m., is that okay?
It's fine,
Okay.
they just said it.
I was just making sure I signed up for the right one, so.
Yeah, it's fine. Yeah, we had to change it. It was technically gonna be at 9 a.m., but because there's another exam going on, we, in both rooms, we had to move it down, or back. Okay, so, same thing with any other patient, if too much fluid can always compromise them as well, because we don't want them to go into overload. So we're watching for those signs and symptoms of fluid overload. A lot of times they can go into shock, and we're gonna talk about the shocks and stuff tomorrow. Hypovolemic shock, they can also later on, when infection becomes a problem, they can go into septic shock. Electrical currents, they can go into cardiogenic shock. Of course, urinary output's the same, okay, we want it to at least be 30 for adults, 30 an hour. And a lot of times it's gonna be a little bit lower in the beginning, because they don't have enough fluid going through them, so we gotta get that back up. We're not gonna talk about bicarb and all that, higher level. So disability, so first 2 level consciousness, and any other kind of, do they have a head injury, do they use drug and alcohol use, do they can go into PTs, do they have sure you have the right, if they come to the hospital and you're working in the emergency room, because DNs can work in the emergency room, do we have the proper PPE on to address a chemical burn? Because we don't want to get that chemical on ourselves. So a lot of times pull them out, or have fire and all that, pull them out, they'll bring them to the ER, or the emergency room, and then we want to remove all the, a lot of times they already have it removed before they even come to us, but they'll remove all the clothing, get it out of there. We don't want any jewelry, nothing on them, because they're going to start swelling, so we're going to have to cut off rings and stuff like that. We don't want them to get that stuff on them, and we have to amputate them. Keep them warm, okay, that's going to be the main thing, is keeping them warm, because their nerve endings might be exposed, and it's going to be painful for them. They'll cut it, they'll just, they don't like rip it off, they'll cut it. We kind of talked about GI, they have lack of blood flow, so they can have constipation and, issues, so we want to prevent that. Okay, and then the main thing with burns is, after all the physical stuff, it's gonna be, psychosocial that we're gonna be worried about also. Because, if you think about it, somebody that's burned, especially on the majority of their body, they're gonna have these scars and they're gonna be going through a lot of surgeries and, bereavements, and pain. Pain can affect a person's mental health, severely. So, we need to make sure they're gonna have PTSD. Like, for example, this isn't a burn example, but like my sister is having a really hard time driving after her accident. So like things like that, they'll be scared to cook, they'll be scared to be around anything that cause that. Nutrition, what do you think is going to be the main source of nutrition? Protein. Okay, protein promotes healing. Okay, we want to stay away from a lot of the fattier foods and stuff. They need to have higher protein, higher fiber diets, because they're going to be lacking that too. Of course, fluid. Pain. Okay, so they're obviously going to need IVs and IV pain medication. Sometimes they'll be on a PCA pump. Sometimes they'll have to be sedated and intubated and, given a paralytic and stuff for their body to heal a little bit before we can bring them out and not have them sedated. A lot of times they don't like to sedate them before they're doing their debridement, but we will give them a lot of pain medication beforehand. And that means giving it in time. So if you know that they're having their tub time, or they're doing a debridement at a certain time, at 9 o'clock, if I give pain medication at 8:55, do you think that's going to be effective? No. IV medication, it takes anywhere from 15 to 30 minutes to start to work in the body, so we need to give it, within enough time for that to last through their tub thing. So you don't want to give it too early, and you don't want to give it too late. And then she said that she didn't really go over all the dressings because there's so many different ones, and it depends on the burn and all that. So just appropriate dressing. The doctor will order that, and then the nutritional support. So once we kind of get through like the initial treatments, then we kind of need to find out, or get them stable. We need to find out, when did this happen, what happened, was it electrical, chemical, all that stuff, did they inhale anything? We need to ask all these different questions. Other injuries, so apparently trauma, any kind of head trauma, if they have anything sticking in them, okay, that trumps the burn. Okay, we're going to treat that first for the burn. And that's more emergency medicine. Y'all already went over pediatrics. That's not gonna do that. I have to put a Foley in to monitor their urine output. They say morphine is the best because morphine is actually it's not just pain medication, it's also a vasodilator. It's going to help dilate everything and help get that blood flow. So a lot of times they like morphine. They do tetanus shots if they haven't had one in 5 years. Especially if they, have anything that, like metal or anything that they, Alright. And so after 3 days, that's whenever we get concerned with infection, because that's whenever bacteria start to colonize and grow and stuff. So we need to be watching for signs of infection. The sooner that we catch them. So what are some signs of infection? Fever. What else? Redness. Swelling. It's going to be hard to tell that on these wounds because they're already kind of swollen and red. But what could be coming out of it? Purulent, drainage, or pus, or whatever. The color of the skin may change too. So. Foul odor. So a lot of times we have to go off of smells when it comes to burns. Their blood glucose. So anytime your blood glucose elevates in the system, that means that there could be a possible infection. If you don't have that. That's why a lot of diabetics, whenever they get an infection, it's hard to control their blood sugar.
I didn't know that.
Hand washing, of course, is your main control. And like a lot of these areas are very sterile. Like they use a lot of sterility and everything that they do. Well, wound cleansing is not normally a sterile procedure. Now putting the dressing back on maybe depends on if they have a skin graft. There's the tub burn, kind of a little older picture. You notice they have a big speaker in there. Sometimes they'll play like soothing music and stuff like to help calm their nerves. And normally when you VNs all day all work in the tub room at Shriners. A lot of times, we don't want to get it on the skin that's not burned. We just want to primarily put it on the skin that's burned. And you don't want it too tight. You don't want it to cause some burns. What happens if you get too tight? Cut it open. We won't go too in detail with grafting, but they, like earlier I said, they have different types of skin grafts. Now they use fish scales and all sorts of stuff. They can do a homograft, which is from an egg diver. They can use pig skin to temporarily cover it. They don't, but the body normally rejects those. So they need something that the body's not going to reject. Because it is another organ, because your skin is an organ. And anything that's that's not your natural organ is going to be a possible rejection. So they might have to be on immunosuppressants and all that stuff, just like a liver or transplant patient. They have all sorts of stuff now. Well, that's another thing, if they get it from another piece, like, oh, that's what I saw. They got it from the same patient, and they got it from this leg, and the way they have to like shave off. Yeah.
There was a girl in high school. I don't know if you ever remember. She went like, her whole, like, it was like all this, like, she, like, her whole nose and, like, all this was fine. And, like, she had her hair, but, like, all of, like, from her chin down to, like, her whole mouth. It was crazy. I was like, yeah. But, like, she was already healed. It happened when she was, like, a lot younger. But she was really nice. She was so nice. And you could see like how that was like grass. It looked like that, like the squares. You could see, like how her skin like healed over time. You could see like the difference.
They'll have to do physical therapy because they don't want to prevent any contractions or any deformities.
Oh my god.
That's them taking off the skin.
Oh no, I couldn't.
As a child.
Oh, yeah, that's a kid.
Oh my gosh. What happened to that baby? Oh Jesus. Oh no.
So, and at Shriners,
Oh.
unfortunately, it's a lot of kids from other countries, especially Mexico. I don't know. I had a patient where I guess the dad or somebody came in and threw acid on the mom and the baby. And the mom was at UTV and the baby was at Shriners. That's what I'm saying.
What the world?
Yeah, they'll fly them in.
That's the same baby?
Yeah, the same baby.
Isn't it true the hands are the hardest because of the movement?
You see all the like you can like she said you can see where the graft was. So if you can imagine that's what they have to live with and see every single day. And it's reminding them every single day about their experience. And that's the pictures.
What the?
Okay,
What just happened?
Wait, what the chin melted into the chin? What?
So she got contracted.
Well, after she got burned?
Oh my God.
Well, how did she get? Did she do
So
the?
it looks like they did. It looks like they did some. They might have taken some of that place.
That's the worst person I've ever seen in my life.
Skin heal maybe.
But
They left her like that?
that person that did that. No, because like
Doesn't
your mouth,
matter. They may not stay that way.
your mouth
but-
has to close, you know, and the way that is done.
I don't think nobody did it that way. I think it's not, because I was reading a little bit about it. I don't think it was done that way.
But the cheek is in the shoulder. Like, how can that? He must have.
That looked like
To ask her
It's almost like plastic.
it looked like acid to me, like it melted her, like she.
It just however, wherever it's at, that's what it forms. That's how it forms.
And you never know, this could have been a patient that something like they came, maybe they botched some, you know what I mean? Like she came over from somewhere. And it looks like she's not all the way healed down at the bottom either.
The stuff people
Just
do.
their criteria for admission, y'all need to know.
That's crazy.
Burn survivor.
Yeah, that's more on like when you work in these areas, you gotta focus on like the survival, like they survive, and you just gotta keep reminding them of that, and that they'll, they will heal, their skin will heal, they not look the same, but it's just a program that they have, or you can volunteer.
Nah, you messed us up. Don't nobody want to talk no more.
That's the blue.
Oh, what time do you have to be here Monday for a project for the next?
9 o'clock.
Then the book project?
No,